Thank you, Liz. Thank you, Mario. I want to start off first by echoing a colleague of mine, Tom Cole. From earlier this morning, for years, Congress has been preparing to reinforce our infectious disease readiness. You know, from the last 5 years, 4 of those we were in the majority. We have increased NIH funding by almost 40%, averaging almost $2 billion a year preparing for what we see today with the coronavirus. We created the Infectious Disease Rapid Response Fund as well. It was an idea by Tom Cole. It took us 2 years, but we were able to build it. We want to be prepared, having learned from Ebola and others, when it comes to the future of where we're directing. I do want to thank the President and give him credit in his administration, having leaned in from day one, taking preemptive and decisive measures, including travel restriction and aggressive quarantines. This is something some people would criticize from the beginning. When you look back in hindsight, it was the right decision at the right time. We want to continue to keep America safe from the coronavirus. Today, appropriation leaders from both chambers have met to discuss adequate funding. This is not a time to play politics. We want to make sure we have all the funding needed. We want to make sure the money is going, and we also want to make sure there's accountability for that. I have great confidence in Kay Granger and her leadership in working through this, and we want to make sure it comes through as quickly as possible, the supplemental to the floor. Despite what Chuck Schumer wants to play politics this time with other press releases, that's not the time to do it. It's now time to put the American public first. I want to thank Mario for his comments and for coming today and for his resolution that will be on the floor. No one knows firsthand more than Mario and his family of what socialism will do. From his district alone, the thousands of individuals, from one themselves being held in prison to those that have family members today, from those that have risked their lives for the idea of coming to America, for the idea of freedom. To have the lead candidate for the Democrat, Bernie Sanders, credit Fidel Castro was appalling. Today, those in the House will have an opportunity to vote when it comes to a PQ of where they really want to stand. Do they stand with Bernie, or do they stand for freedom? For those who believe that maybe Bernie Sanders just misspoke when he said truth is truth, all right. Only this time he went one step further. He praised the Communist Party of China, and he claims raising people out of poverty. This is the same government that if you disagree, you get put in prison. This is the same government that if you want to buy an airline ticket or a train ticket, you first have to check your social score. What's most interesting when you listen to that debate last night, it wasn't just Bernie that had different ideas. Another leading candidate on the Democratic side is one who has set the record for the most money spent on television, and he hasn't even had one vote yet for anyone who ran for president. But I believe he thinks he can buy the presidency, because when you listened to him last night, he apparently bought this house. He wanted praise because he says 21 of the individuals that gave Nancy Pelosi the speakership, he bought those seats. It'd be interesting to know if any of those 21 have endorsed him, to know how far his money went. I don't think Americans want a president to buy the seat, and I don't think America wants somebody to buy a house. Maybe that's why this House has not worked so well. Maybe that's why they spent their entire majority of just investigating. Is that what Bloomberg bought? Interesting question. But only those of those 21 that he bought, I guess, could answer that question. I wonder how many of those 21 voted for impeachment. Don't know. Question, how much did he spend? $110 million he bragged about. He said he bought those, and he worked with Nancy Pelosi to make her speaker. With that, open up for questions. Yes, sir.
You talked extensively at this press conference, other press conferences, about Sanders' record. Obviously, in 2016, Democrats made a point about President Trump's record, Access Hollywood. Republicans did the same thing. It worked out pretty well for him. Why do you think that this works in this sense? Attacking Senator Sanders and the things he purports to be for, and why do you think that would be successful in contrast to what happened in 2016 with President Trump?
I never heard President Trump say he praised the socialist form of government.
But there was a pretty, dicey things about his record, and that worked out well for Republicans in 2016.
I never heard President Trump say he wanted America to become a socialist country. I never heard President Trump praise Fidel Castro or a regime that people would risk their lives to escape. I never heard that President Trump honeymooned in the Soviet Union. So I'm not sure that will work well, but if the Democratic Party believes that will, he's the leading candidate, and I think we can have the American public make that decision. At the end of the day, I think President Trump will be reelected and by a higher margin. Why? Not because of Bernie Sanders, not because of Bernie Sanders' socialist beliefs, but because of the record of President Trump. Strongest economy you had in more than 50 years, lifting every American up, rebuilding a military, rebuilding the VA, giving people the right to try when they have a terminal disease, making government run more efficient and more accountable, and preparing us even when China brings us a coronavirus to try to protect the Americans. I think there are so many reasons why President Trump will be reelected, and I think when you sit down to it, Bloomberg may want to try to buy another term for Speaker Pelosi, but I don't think the American public will believe in that as well. Yes, sir.
What do you want specifically in a coronavirus package? How much money and what does Congress need to do specifically?
Well, a supplemental was put up, and the way most all supplementals work, we put together the Appropriations Committee, sit down with NIH, CDC, see what we need right now. We want to make sure from a testing kit, the resources there to supply, and our need of where to go. We have resources prior, but when a supplemental comes, walking all the way through, talking to the experts. As Steve mentioned, we've been at the White House numerous times. It wasn't just even bipartisan, it was bicameral in those meetings. This is not a time to play politics. Just as you watched, if you would take anything that we had said during the Ebola crisis when we had a different administration, being able to work together to keep America safe, I think that will be fundamental for us.
How much money do you anticipate?
Well, that's why the Appropriation Committee met together. We want to make sure there is enough money. We could always come back. I think $2 billion is a little low on the side. I think we're probably looking at $4 billion in this process. Having spoken to Democrat House members from Appropriations, that's what they were looking. Having spoken to Tom Cole and Roy Blunt have been the leader in rebuilding the CDC and NIH. If there's any people that deserve credit, when you talk to Tom Cole, working 2.5 years to get an infectious disease rapid response fund, something other people didn't think about, but thinking about this day coming. Are we prepared? And having that fund build and averaging more than $2 billion a year and building up for that. My greater concern is, what if H.R. 3 from the Democrats became law? Wiping out the cures of the future when we see as the world continues to change that we are going to need new cures. We're going to need a vaccine. Do we have all the science behind what we need to get that vaccine? We have a number of pharmaceutical companies over in China today supplying them the best way to treat. How do we speed this process up? The lack of accountability from China harms the entire world. And I think America has been leading in this charge, and we want to make sure we can continue to do it because this is something not created here but can still come here. Yes.
Do you think there needs to be a czar, if you will, to coordinate?
I think
this?
Secretary Azar has been acting in that way, and just his background and others, I think he's done a good job at that. I want to make sure everybody is working together. Currently where we are, I think, works well. What happens in these situations, a lot has to happen on the state level. So governors need to be engaged in a greater level. They need to engage with us. The federal government can provide resources, but a lot of those actions will be provided in the state. I'm, being from California, have a great concern. The amount of homeless that we have in California is very concerning to me on so many different levels. But with the fear of coronavirus coming, and you know where coronavirus started in the east, but where you pretty much travel to a lot is into California. If it was to get into the homeless population, how do you quarantine inside a homeless population and with the health care itself? What is Governor Gavin Newsom doing at this moment in time? What if this came into a college when you have a campus, when you room within dorms and others? These are the preparations that I believe we need to be working on as well. But that's why you have to engage the governors. And the secretary, having been in the healthcare industry, having worked as the Secretary of Health and Human Services, understands government as well. So it's not just plopping somebody in. They've got to have an understanding of government and also from the medical community as well. And Azar is really at the right person at the right time. Yes, sir.
Markets and the public are looking very close at this coronavirus. Bottom line, what's your message as far as how serious this coming threat is and the ability of the U.S. government to contain it? Is this very serious? Is it not? What level are we looking at?
This is a serious situation, and that's why this administration has taken it that way. When the president went out on that weekend and stopped any flights coming in, he also led the world where others would follow him to try to contain it just to China. The challenge here is the lack of accountability coming from China. Our scientists from the very beginning have been communicating, but they have not been as open. We've now find that it started in November. Maybe if they had told us then, we could have been doing something much better about it now. If they had allowed our scientists in sooner, maybe we could have been able to deal with even on a different level. But the movement of it and being so contagious means that it can move at a rapid speed. The mortality level is at a lower level, higher than a flu. But from a pandemic situation, once it gets in, how do you control it from growing? That's the preparation that we've been doing now. That's the preparation that this president had done before, trying to contain it to China. Unfortunately, has Iran been open, and how big is it within Iran? Italy has been open with their discussions. I think this is a moment in time where the world works together. America has been a leader in so much of this. That's why I'm proud of the fact in our majority of what we did to increase the funding in NIH and CDC, forward-looking to this day coming. We have some tremendous experts in there, and really, if the other countries would unshackle what's holding them back from allowing our experts to help, I think the world would be safer sooner. Yes?
You're a leader in the day of aid, and I'm just wondering if you think that the president is being aided by Russia in this reaction.
No. Yes?
The Born Alive Second Act was recently defeated yesterday.
Unfortunately, yes.
Do you believe that a fetus that survives abortion is a human being?
Do I believe, say that one more time?
A fetus that survives abortion is a human being.
Yes, I do. I think almost everybody in the world would believe that too. If bleeding, it's a heart that beats, it's a lung that breathes, and to me, in any definition, that would be murder. Thank you very much.